Hi, everyone. Welcome, and thank you for joining today's webinar by the Prevention Collaborative. We really appreciate having people from different parts of the world, and I will say good morning, good afternoon, or good evening, depending on where you're joining us from. Our webinar today will be on COMBAT program, and COMBAT stands for Community-Based Action Teams. And this program was developed by the Gender Studies and Human Rights Documentation Center in Ghana. And we will have a chance to hear from colleagues sharing a success story from rural Ghana. So I'm Rita Nyiratunga, and I work with the Prevention Collaborative as a Senior Associate Capacity Development. And I'm really delighted to be the moderator of today's webinar. For those of you who may be joining us for the first time, the Prevention Collaborative is a global organization that aims to contribute to the prevention of violence against women and their children. We know that violence is preventable, and we're made of a growing network of activists, practitioners, and researchers seeking to reimagine prevention. We do this in collaboration with others to synthesize and share learning from research and practice, and to apply this to support the development, innovation, and adaptation of effective violence prevention programs. So today we have two great people to share with us about the COMBAT program. We have Dorcas Coker-Appiah and Dr. Adolphina Addo-Lartey. And Dorcas Coker-Appiah, who co-developed the COMBAT intervention that we'll be hearing about today, is a lawyer by profession and a dedicated women's rights activist. She is the Executive Director of Gender Studies and Human Rights Documentation Center in Ghana. She co-edited the first comprehensive study of violence against women in Ghana, findings of which led to advocacy for the passage of the Domestic Violence Act in May 2007 in Ghana. Dorcas has worked on issues of violence against women at both national and international levels, and she serves as a member of the United Nations CEDAW Committee. Thanks for being with us, Dorcas. We also have Dr. Adolphina Addo-Lartey, who is a public health epidemiologist who has done extensive research in the area of women's health as well as gender and health issues in Ghana. She was a co-principal investigator on the impact assessment of the rural response system to prevent violence against women in Ghana, also known as the COMBAT Intervention Project, which we'll know more about today. Currently, Dr. Addo-Lartey is a lecturer at the University of Ghana's School of Public Health and an adjunct faculty at the New York University College of Global Public Health. She teaches epidemiology, disease control, assessment of community health needs and resources, and research methods in public health. So thank you and welcome, Dr. Adolphina. We really appreciate you being there to present today. Adolphina and Dorcas will have 45 minutes to share their presentation. And after that, we'll have a question and answer session that will take 20 to 30 minutes. So for the sake of how we're going to run this webinar, if as they present you have any comment, question, and anything you need to communicate, please go ahead and add them to the chat box, and we'll look at those and respond during the Q&A session. Otherwise, enjoy to listening to Adolphina and Dorcas. So over to you, Dorcas and Adolphina. Thank you.
Thank you, Priya. So welcome to all of you joining us for this webinar. It's a pleasure to be able to share the findings, share these interventions and the findings that we got after 18 months of implementation. If you look at the background, we're going to give you a short background to the intervention, to Ghana, and then the others. So when we talk about Ghana, like most low and middle income countries, violence against women is driven by patriarchal and socio-cultural values that condone VAWG. Studies have highlighted the prevalence of violence and the high degree of tolerance of violence against women in Ghana. And you see that we have some figures for you that in 2008, the Ghana Demographic and Health Survey found that 1 in 5 women experienced sexual and or physical IPV in the past year. Our baseline for the study also showed that 21% of women aged between 18 to 49 years experienced sexual and or physical IPV. 23% of men aged 18 and above reported having perpetrated sexual and or physical IPV, and there are high levels of emotional IPV victimization perpetration. Next slide, please. The rural response system or the combat intervention was developed by us after a study that we did in 1998 looking at the causes and consequences of violence. And we developed this to address some of the key findings that we found from the study, and that was that violence against women was an issue that was highly ignored. People did not know about it due to the socio-cultural norms. The intervention by state agencies was problematic. There was a lot of victim blaming and so on and so forth. So that is what led us to develop this intervention. And the intervention is basically working with a group of community-based, can we go back to the previous slide? Yes. Working with a group of women and men in the community who we train to do the awareness raising in their communities. We also work with civil society organizations in the community to also build their capacity to understand the issues around violence against women. And also the key staff of state agencies, such as the police, the Department of Health, Social Welfare, and other institutions that respond to violence against women and girls in one way or the other. Next slide, please. Next slide, yes. So the objectives of the intervention, which is the rural response system, is to increase knowledge through awareness raising on gender-based violence. As I said, one of the findings was that people were unaware of it, or even if they did, they didn't think that it was a problem. It was also one of the objectives is also to positively change social and gender norms and behaviors that perpetuate gender inequality and result in VAWG. The other objective is to engage state structures for response services and protection of women. And lastly, to provide support to victims of violence to access justice and services. We found that this was very critical because due to the socialization of women in the society, they think that reporting incidents of violence, domestic violence or interpartner violence was not something that they should be doing. And so it resulted in very low reporting. And that is why if we wanted to change the people's understanding of violence, we needed to encourage victims to support, to report and to access justice and other services. Next slide, please. Okay, so you have on the screen intervention model, logic model, and it's basically looking at the top, which is when we go into the community We do what we call community entry, introducing ourselves and the project to the community, engaging with the community leadership in our part of the world. It has to be the traditional leaders who we must get on our side if we want to then be able to engage in the community. And then once we have done all the necessary to do the community entry, we then introduce the project and we give them the criteria based on which they should select the volunteers who will be trained as combat. And then once we've done all of that, then we go into the training of the combats. And the training has, there's a comprehensive manual that we use for the training. We start off with, examining for people to, for the participants to really then re-examine themselves, the understanding of what it is, the issues around social norms, gender roles, and so on and so forth. So, and then before we go on into definitions of violence, the causes and consequences, and then we also train them on how they will do their work in the community. So we have a system, we introduce them to the system in terms of how they are supposed to engage with the community, reporting, and so on and so forth. So that's the first line. And then, about a year, every year, we train the combat. We do what we call a refresher training, because sometimes they may have forgotten some of the things, or sometimes some issues come up in the course of their work, which they think that they need more training on. And then we use that opportunity to train them. So once they've done the training, then their main activities are providing support to the survivors, either to access justice or to access some other services, or sometimes just to be there to listen to them. They also do reference. If it's a case that has come before them and they think that that case needs to go to the police or the social welfare or health or some other state agency, then they can refer that case. And this is quite important, because then once a case is referred by a combat to the particular state agency, we realize that they take it very seriously, because they know that there's somebody or some group somewhere that is overlooking what they're doing. Because most of the time, some of the challenges that people who report some of these cases face is that the response is not quite what is expected. And so, but with the combat's intervention reference, then they know that they have to do things, as expected. And then they do counseling. In the work that they do, we realize that it's not all the cases that need to be referred to the police or any state agencies. Sometimes it's just, the issue is just about non-communication between the partners. So all they do, or between parents and children and so on, so all they do is to do a bit of counseling, some counseling for them to understand. Because what we realize is that there's a lack of communication among family members, whether it's the partners or partners and their children. So this is, this aspect of their work is very, very important. And then, of course, they do the final one, activities, the general sensitization and awareness raising. They go around their communities talking about the issues of VAWG, talking about some of the social, harmful social norms that don't bring, peace in the home and that lead to violence and so on and so forth. And they do this all across their communities, and they use all opportunities to be able to talk about this. And the opportunities will be, maybe there's a funeral, they're giving a slot, maybe they go to the church or the mosque, as time is set aside for them to talk about it. Sometimes they use community radio systems to go and talk about these issues. So that is what they do. And basically, after all, when they're doing all of this, what we do then is to do the monitoring. So we go quarterly to talk to the community members, to talk to the combat themselves as to how they're, in terms of the work they're doing, if there have been any challenges, any unforeseen circumstances, any unintended benefits of what they have been doing, of what they're doing, then we'll give them the necessary support. Something I also talked about that I work with the state agencies, and sometimes we do training with the other state agencies, with some of the state agencies. So like the police, health, social welfare, and then other CSOs. And this is because what we found from research earlier was that state agency personnel, as people from the community, have the same socialization and biases against women. And so it's important to then change the way they view their socialization so that they are able then to provide effective support and response to victims. And some of the training content have either the gender sensitive VAWG, domestic violence, how we talk about the laws. We also talk about, train them on family laws, counseling, reporting, and family laws is really about, we have a law on children, we have a law on interstate succession, we have, issues around marriage, property rights. These are all issues that we found that can lead to violence. And so we let them understand all of this, train them on all of this so that they can use it for their awareness raising and sensitization. Okay, can we go to the next slide, please? Okay. Yes, so I'll now hand over to Adolphina to do the evaluation.
All right, hello everyone, I'm Adolphina, and I will be telling you about how we did the impact assessment for this great intervention. So our design was a randomized control trial. So that means that we needed intervention districts and our control, and we had 2 intervention districts and 2 control districts. Now, all of them were in the central region of Ghana, and we were certain to try to pick, randomly of course, pick some inland as well as coastal areas so that we can look at differences in characteristics and how that might also influence the impact of the evaluation. So for the methods itself, we did a mixed method study. So that means that we had our quantitative and the qualitative components. Okay. Now for the quantitative, what we did was we did an initial baseline survey, and then they delivered the intervention over 18 months. But we did the end-line survey at 24 months. So give it a little bit of time after the intervention ended. And that's what we did. And then we made certain that our numbers at baseline were fairly similar to the participants at end line. Yes, we surveyed them in the community, a random sample drawn from the community. So it's possible that someone could be in the study at baseline, but they were not in there at end line. But then they all always came from the same communities that we had selected. Okay, so that's over 4,000 participants, both at baseline and end line for the quantitative. And our research assistants were also trained extensively over about a week and a half before we did our pre-testing, so that they will be primed on issues about violence against women, because research assistants may have done previous work on research in general, but when it comes to discussing issues about violence, there's a lot of worry about safety, for example, of talking about that incident, talking with the victim. So there was a lot of training that went on before we did our data collection. Now, for the qualitative component, we had focus group discussions with community members, and that was both men, women, and we tried to do different age groups as well as women younger than 35, more than 35. So try to get at diverse populations to see their experiences about violence, and then as well as their attitudes towards violence, and then what they think about gender equity and things of that nature. Now, the in-depth interviews components, we drew participants from the quantitative survey. So what we did then was we primed the research assistants and the supervisors, so that when they interviewed someone and based on experiences that are being recounted, they get the impression that the person has experienced some form of violence, whether physical, sexual, emotional, or otherwise. Then what they would do as the research assistant is talk to the supervisor, who would then approach the participants later on to find out that would they be willing to take part in an in-depth interview so that they can tell us a bit more about their experiences, and then also share their knowledge about a few things that we wanted to know more about for anyone that might have experienced any such situation. So that was for the in-depth interviews. And then we did that in both intervention districts. Then for the key informant interviews, I believe Dorcas mentioned about how the intervention was designed to work, for the combats to work with the civil service organizations, civil society, organizations, as well as the state agencies. So for the key informant interviews, what we did was to talk with the heads heads of the institutions or the directors. So for example, the police, social welfare, Ghana Health Service, basically all the groups that the combat intervention had, the combats were working with, and then also any group that comes into contact with women that might have experienced any form of violence. Okay. Next slide, please. So just a little bit about the coverage of the intervention, and then I'll roll that in together with some of the stories that participants shared about the experiences of the combat intervention. So in terms of whether or not they've heard about combat, we see that more women than men had heard about combat, about 48% women as opposed to 25% men. Well, that might be because generally the combat intervention was supposed to target women, but then it was done in the community. So that means both men and women were supposed to participate. And a lot of the messages were for both gender. So I would say that yes, women participated more, but men could also have, participated much more. So generally, from what you're seeing here, you'd see that more women than men actually interacted with the combats, and they also participated in the different activities, whether it was home visits or one-on-one chats, or the messages they get from the information center. And that was actually a dawn broadcast message that was done with a megaphone in the intervention communities by the combats. Okay, so the quote that I have on your screen is from a female in the focus group discussion, sharing what she had heard about combats and what she saw. Okay, and basically what she was saying was that for the combats that come from her community, which was Otenkran, they usually travel to other surrounding areas as well. So that means combats were not just working in the communities they were based, but as long as it was an intervention district, they went to adjoining towns and communities. Okay. And she said that she remember. Please, yeah. She said that she had remembered seeing them. There was a wedding, and they were there. And then I think when the opportunities come up, maybe does anybody have any advice, something to share? These are opportunities for you to share information, because combat basically is about happy couple. I mean, we want a happy family, okay? And once we take violence out of the equation, that is what we are going to get. So weddings are a good place to talk about how we can all live, in harmony and have a good society. Then also they were at PTA, school PTAs, to take the opportunity to share some information. And as Dorcas has mentioned, their training was not just about violence. So they could talk about land inheritance, they could talk about other issues that couples might have, for example, child neglect, which then would be violence against the child and the spouse as well. So they basically covered a lot of material. Okay. Please, next slide. Thank you. Now, here we are trying to show some of the findings with regard to experience of violence, that is by the women, and then self-reported perpetration by the men. Okay, so what we are seeing is that there was a significant reduction in sexual violence, as in women's experience of sexual violence. So sexual violence compared to baseline had gone down by 55%, and this was significant. So that was really, really good, because generally sexual violence is one of the more common violence that women experience. Okay. Then there was also a 50% reduction in women's experience of physical violence. So physical violence is another thing that had gone down. That was non-significant, but a reduction of violence in any form, I think we would all agree, is a good thing. Then we had a reduction in men's reported perpetration. So what they are recounting as in what they do with their partners, not just spouses. There was a reduction, non-significant, but a reduction nonetheless. And then there was also almost a 30% reduction in emotional IPV. So I think that's something that we need to also keep in mind when we are talking about IPV, that it's not always sexual or physical, but verbal abuse or even economic abuse, as in taking their earnings from them, or all that constitutes violence against the woman. Okay. Next slide, please. Okay. Now, for the quantitative findings that we had on gender attitudes, I'm not showing that here because generally what we had observed was that there was improvement in gender attitudes, as in how much more equitable men versus women got. Okay, but for the social norms, what we also saw was that there was an improvement, but it wasn't significant. But qualitatively, what we found corroborates what we had seen, what we saw in the quantitative, in the sense that we now have a quote that beating and throwing out of wives by husbands, for example, it rarely happens these days, which tells us that people are beginning to feel a lot more in terms of how the other gender perceives what they do. Okay, then husbands, and of course it's being attributed to combats, which was what we were hoping to hear if the intervention really worked, and it did. Then husbands are also very much aware that if they commit such an act, combats are around and they will deal with them. Of course, let me just say that deal with them doesn't mean they will arrest them, because combats do not do that. But what it's saying is that combats were also mediators. Okay, so if you have issues, before they escalate to levels whereby you want authorities to come in, if both parties request for combats, that can happen. And then combats are also there to assist. For example, if a victim wanted to report and didn't know how to proceed, combats could give some advice on where do you start from, do you need help to do that, and if they do, then they go with them. So it's never about combats initiating that, well, you've been beaten, so you should do something about it. That was not what combats did. Okay. Then this person also said that even if there are issues between the couples, they usually now quarrel in the confines of their homes. So things that you could see, like people coming out into the streets or their neighborhoods and fighting and yelling, now it was on the low side, and people just try to resolve things amicably within their rooms, which is a good thing to happen. Okay. Next slide, please. Right. Then another aspect of impact assessment was on how combat has influenced mental health of both men and women, as well as controlling behavior, especially by the men towards the women. Okay. So what we saw was that for the men, there was no significant improvement in mental health or their reported control behavior. But for the women, what they were reporting that they had experienced from the men was a little bit different. Okay, the women reported improved mental health, which is good because I mean we know that your health is wealth, and mental health is basically going to affect every aspect of your life, whether physical, reproductive, or whatever. So this is good. That is, there's a statistically significant reduction in negative attributes. Okay. Then the women's partners, they reported that their partners were also less controlling. Okay, and that makes for a happy home. So that is also good to hear. Next slide, please. Okay. So this is just another quote to confirm what we had seen in the quantitative, that when the combats meet them in public places, they share knowledge, okay? But then they were also creating an awareness that this behavior of violence, especially against women and girls, it's a pandemic, and people need to actually change their behaviors because social norms can only change if the community changes, okay? And then this gentleman also said that people's attitudes towards violence needs to change, okay? And the comments made them understand that every human being has a right, including women and child. And I think this was a highly impactful thing to say, that the combats made them to understand that every human being has a right. So what that is telling us is that combats did not just deliver the education and leave, but they tried to work with people to make sure that they had all reached the level whereby there was a consensus that this and that practice is not right. Next slide, please. Okay. So for our key messages from the intervention, just as a nutshell, what we are reporting, at least for here today, is that the combat intervention reduced women's experience of intimate partner violence. And this was a statistically significant reduction in perpetration of sexual violence. So that is good. Then we also saw that there was an improvement in mental health, which was significant. And then partners controlling behavior was also reduced. And then there were positive effects on gender attitude, as in people became more gender equitable in the community, which was good. We also saw a significant impact of the intervention among men with regard to emotional IPV. Although physical IPV perpetration was a non-significant reduction, it was a reduction nonetheless. And for that, we are really happy because, I mean, nobody wants to be beaten, dragged, kicked, or any such thing of the sort. Okay. For those that might have a question about why we didn't ask the men whether the women were beating them, we're sorry about that. Hopefully, at another opportune time, we might be able to do some research for the men in that area. All right. Then the last key message that I want to share with you is that we didn't see any significant impact on sexual IPV penetration as reported by the men, but at least from the women's side, they reported that their experiences had gone down. So that was good. Okay. All right, thanks. I think Dorcas will take it from here and tell you a bit more about the lessons we learned.
Thanks, Adolphina.
Thank you.
Yeah, Dorcas, just to encourage participants to keep sending the questions in the chat box, please. And go ahead, Dorcas. Sorry.
Yes, okay. So there are a few lessons that I thought we should share with you. And then that is the fact that, you know, in terms of our context, there's limited awareness of the drivers and consequences of VAWG, especially in rural communities. And this means that we need, in terms of awareness raising, we need a continued and consistent work around raising awareness on the types, drivers, and consequences of VAWG, alongside the legal rights of victims and the responsibilities of first responders. As I said, this has been a problem. That is why we're not seeing enough reported cases, and also the fact that responders are not, that is the police, social welfare, their attitude then, leads victims to not report at all, or not to seek the service of the agency. Next, please. Next slide. Yes. All right. So the other one is that we are saying that we saw that, to make some changes, norm change, you need to work with the whole community. And when we talk about the community, we're talking about the leadership of the community. We are talking about the men and women, young women, young men in the community. They're all important stakeholders in making the changes that we want to see. In so doing, we build on the skills, agency, and knowledge that the community and its individual members bring to the intervention. And a recognition of this is important. That is what allows the community to think and to feel that this is our intervention, and therefore we would continue to make the changes that will be to our benefit. Next slide. Okay, so in terms of the selection of combats, I've seen that somebody has asked the question, how are the combats selected? And, when I'll come to that. But we're saying that community involvement in the selection of the combat is critical to its acceptance. So we don't go into the community and then, decide that as outsiders, we're picking this one and that one and that one to be trained. We give the community's members, at a forum for them to decide or to make an input into who can be trained as a combat. And sometimes what happens is that people volunteer. Once we say that this is it, people would volunteer, but then we give the community members an opportunity to say whether they think this person would fulfill the criteria that we have designated for selection. And some of the criteria includes that the person is not himself or herself violent, that they are people who would be able to keep the confidence, the secrets, that it's the secrets that people would tell them about their private, intimate things, because they're supposed to be people who would not, as we say in our own language, they are not like radio stations. So if you tell them something, you might as well have gone to a radio station and then told your story there for everybody to hear. So these are some of the criteria. We also expect, in terms of some of the criteria, that these will be people who would be acceptable to the community. They also must have some basic education, because we give them materials. Even though we take them through all the materials, they should be able to refer, when they're doing the awareness raising, to refer every now and then to what is in the materials that we have given them. And most importantly, it's also important that we don't allow community members or community leaders to impose their favorites as, for the training as combats, because they may not have the requisite qualification. And in what we've realized in rural communities is that sometimes when an NGO or a group from outside come in to do something, the leadership would then, think that, oh, this will be an opportunity for my son or my daughter or my relative. And they may not necessarily have the, qualities that we are looking for. And so it's really important that we don't allow the community leaders to impose their favorites. That is why we give the opportunity for the community members to also make an input as to who they think is the best person to be trained. Next, please. So in terms of training, as I said, we have a comprehensive training manual, and it's important that you spend time on all the different components of the manual, as they all contribute to full understanding of the VAWG causes and consequences. It's also important that we, in fixing the training programs and activities, you do it together with the members of the combat to avoid conflict with their own activities. Remember, these are all volunteers. They have their own work, and mostly in the rural communities, they will be either farmers or fishermen. So you need to give them space, because we are bringing them for 5 days. So you should do it in a way that will not affect their own activities, because we are not paying them. It's a voluntary work, and therefore we should do it at their convenience. And normally when you engage with them and then you're able to find a convenient time for everybody, then you can do the training. And also, I think that one of using adult training methodologies is the way to go. There are a lot of, in our training, we do a lot of role plays, exercises, to make whatever we are trying to impart very relevant. Lectures are very limited because, working with adults, some of whom may not have very high education, if you start using, lecturing them, you would lose them. So that's what we think that, a lesson that we're taking from here. Then I think the next, I don't know whether there's another slide. Next slide, yes. Okay. So we also need the combats need continued support. And what we do in this case is that we do regular monitoring of their work, and that is not only going to the field, but also leaving an open communication channel. They can call you anytime. This is what happened when we got to this community. Somebody asked this question. We weren't too sure how to respond to that question. So we said we'll get back to them, and and so then you can give them the information. So that support is really, really important, because we are not experts, but they are able in their own understanding to pass on the information to people. So it's not everything. You can't do all the training at the time. That's why it's important for you to also do the follow-up training after several months or so that what they have forgotten or what they have done, they have not learned at all, you'll be able to tell them. And for me, that is really, really something that you need to do if you're doing this intervention. That regular monitoring and support for the combat. Sometimes in our monitoring, we go to the field when they're doing their presentations, and then at the end of it, we'll sit with them and say, okay, this person asked this question, this is how it should have gone, and or you said this, but that is not quite how you should have said it. So this is really important. I think the last, yes, okay. So in terms of our conclusions, we're saying that norm-change interventions can be effective in reducing VAWG within programmatic timeframes, but require work with the whole community. We have said so already in terms of the lessons learned. The careful selection, training, and supervision of community facilitators are required for intervention success. As I said, people respond to others who are of this, who are the same as them or similar to them. So as if you're going to some community that you're viewed as a stranger, and you start talking to them about changes, their norms, their traditions and culture, you are going to fall into some trouble. That's why it's important that you have community volunteers or facilitators to ensure that the intervention, because once they understand what you're trying to say, then it's easier for them to pass on the message and convince other people to use the information. It's also, what we are also saying is that prevention is more effective when it's supplemented by support for survivors. What we found is that sometimes survivors would come, they have heard information, they want to go and report. Sometimes they don't know where to go, even when they do know, sometimes they need just somebody to accompany them. So the accompaniment that we do for the survivors is also very important. The combat, if the survivor feels that in reporting they need somebody to go with them, then they're available to do so. And then we're saying that communities are also important targets for VAWG prevention programming. You can have a big community, a small community, but the whole idea is that you have to start at some point, and with those communities, because especially in our rural communities, they are more cohesive. So it's easier for you to pass on information rather than, we found that, doing this kind of work, you get better results in smaller rural communities than in urbanized communities. So that's something that we have to bear in mind. That also we've noticed that for interventions to be effective, or they're more likely to be effective when they are community-led, locally owned and context-specific. As I said, when the community themselves have selected somebody to go and train, they come back, they're talking about norms, they're talking about laws, and so on and so forth. They have that, they believe that, yes, we've done something. And so they see the combat as something that they own. And of course, it deals with their specific context. And then lastly, we are saying that there's potential to scale up delivery of this locally tested prevention approach to other districts of Ghana. But it's important that the core elements of the intervention are retained and scaled up. We try to, just to say something, before, there's a group that has tried to replicate this intervention. And lately, we've just found that the first part of the training, where we We really work with the individuals of the training to change their attitudes. They have taken that out and they only focus on the loss. And for me, I don't think that is that is the important thing. So lastly, I think that this is a quote from one of our FGD participants. It says, now you know, when there's any problems, you have combats to talk to. We know when we call on them, there will be peace. That is why we call on them. Violence is a bad practice. So having someone mediate is a good thing, and we are comfortable. Thank you.
Let me clap for you. Thank you so much. Thank you, Dorcas. Thank you, Adolphina, for the great presentation. We have many questions, and I wanted to suggest if we could start with the questions that were shared by participants in the chat box. We'll make sure that we have some few minutes for people if there are other questions they may have. So the first question we got from Inma, you touched on it because she was asking about how the combats were selected. But Inma, please feel free if the answers Dorcas gave was not comprehensive enough, you can come back to that. And we had another question about the selection criteria from Laurie. What were the criteria for accepting someone as a volunteer, I guess a combatant? And another question from Lina Digolo. She wanted to know if you have given any other specialized training to the combats to equip them with skills to provide counseling and support services. And I know the same question came later with Laurie Hesse, who asked that you could speak a bit about the counseling that combat do with couple. If you combine the two questions because they are talking about. So we also had another question from Gabrielle. She wanted to know, how do you explain the reduction in women reporting experience of sexual IPV, but an increase in men reporting sexual IPV prevention? A fourth question probably for you to have 2 by 2 if possible.
Okay.
Yeah, hello, can I answer that one now?
Yeah, I think
Brian? Yeah.
Adolphina can answer the last question about the difference, how you got the women sexual IPV improving and men perpetration, and then I'll respond to the others.
Okay. All right. So I think I have about 3 that I can touch on.
Yeah.
First of all, for the question about the sexual IPV. So what we are seeing from the graph is a non-significant increase in sexual IPV perpetration. Okay. But what the comment was that generally looks like in the, it was fairly high from the beginning, and in the control it was a little bit high. We don't have all the data here, I mean, as in presenting every finding, but there are, we have put out our end-line findings in general, and that's in Global Public Health, Global Health Action Journal. So if you want to know more about all the details of the primary outcomes, you can look at those. But there are other manuscripts that we're working on. For example, the intervention, I had mentioned that we work with inland as well as coastal districts. So additional analysis that we will soon put out, I mean, preliminary analysis is telling us that we have a 57% reduction in sexual IPV, which was significant, but only in the coastal districts. You understand? So in the inland, rather, we have a 53% increase. So then now we need to tease out why we inland. It might have to do with occupational activities. It might have to do with other things going on in inland communities as opposed to the coastal community. So all these subgroup analysis is something that hopefully will be coming out soon. but we do have our methods paper on giving you more details about the methodology for the entire intervention, and then end line findings, the impact assessment, all in global health action. Okay, so that's for that question. Then there was another question about why, if we've noticed that it was a coincidence that the IPV at baseline was high in the intervention communities, and since it's a random sample, that was why the question was, is it a coincidence? I would say yes, it is, and it was, as much as IPV is a bad thing for anyone to experience, and we certainly hope that we can reduce and prevent that to the lowest eventually. It was a good coincidence and a good fortune for us to begin with, because in research, what you want to do is find out if your intervention worked. And how else can you say it worked unless you had something to start with? So it wasn't by design that we picked some as random and some as the intervention and others as control. It was a random draw, but surprisingly, the intervention communities had higher prevalences of IPV, which was then good that the intervention showed reduction in those intervention communities. Okay, so that means that we are happy to say that Dorcas's design for combat worked, and that is great. Although we've learned a lot to make it a lot more better, if that's a word. Okay.
So I think two people asked about how the combats are selected, and I think I mentioned that. I said normally we do this at an open forum in the community, where we would have, community members. Prior to that, we would have gone to the community to talk about the project and what we were supposed to, and then we go back, and then whilst in the first instance, we'll tell them that this is what we will need volunteers to be trained and so on. So when we go back the second time, then those who would either volunteer, self-volunteer, or they'll be volunteered by other people. And this is where then we start, doing a bit of interview, and then also giving the community members an opportunity to say that, we think that this person himself or herself is abusive, and, or she's this or he's that. And therefore, if you select him as a person to lead, nobody would listen to him or her. So that's it's really important. And I did say also is that we have criteria. Some of the questions, that we put across, is this person that is nominating, you're nominating, is he somebody who can keep secrets, who will not divulge information received from victim to others? Is he or she known to be violent himself or herself? Is she somebody well respected in the community? And is that person somebody who has the spirit of volunteerism and will commit to the project? Because mind you, what we realize is that sometimes people volunteer for these assignments because they think that there'll be some pay that goes with it. And so it's important that they know right from day one that there's no pay. But this then gets me to a question that someone has asked about, do we pay them apart from, is it completely voluntary? And yes and no. When they go for training, when they come for the training and so on, we pay for their accommodation, their meals, their transport to and fro from wherever we're doing the training, and we give them a little bit of allowance for their meals whilst they're there. When they go into the community for their sensitization and awareness raising activities, we refund for any transport costs that they may have incurred. So this is, this is as far as any commitments from our part in terms of money goes to them. So it's really, really voluntary. But the interesting thing is that those who have done it over the time are really proud that they are part of it, because it gives them a certain standing within their community, where you find adults who would go to them with their stories, with their support, with their problems, and expect them to help them. So that alone, for some of them, they think that it is, it's enough payment for them. But we do cover all their costs related to the activities. I think that somebody also asked about the kind of training. Yes, Laurie, the counseling that we give to the combat. Laurie says, could you speak a bit about the counseling that combats do with couples or individuals? I've seen some of your training materials, and they seem to draw a lot on actual mediation skills. For the less serious cases, could you speak about what this looked like and what you learned? And then also from, could you speak a bit about the counseling? That I think is a repeat. Yes. So yes, in terms of the training that we do for the counseling, it's a combination of counseling and mediation. Because as I said earlier on, sometimes some of the issues are really not, they are not criminal in nature. They're just misunderstandings about issues. So for instance, you find couples who are, who as a result of issues around money, say the man refuses to give the woman money for some household expenses or for her own, for something that she needs. And this then leads into conflict within, the family. The man would not talk to the woman. The man would say the woman is rude, she wouldn't pay her, she wouldn't give her any money, and so on and so forth. And so this is where the issue around mediation. So then the training will talk about, if something like this, how do you engage with a couple to be able to understand that, in a relationship, it's a matter of give and take. Maybe you don't understand the situation. How do you get them to communicate? Because we find that lack of communication in most of the cases is at the base of some of the issues, the abusive issues that we find in the community, in the relationships. So this is how they have, we have done this over the time, and so the counseling. And so if you're looking at counseling, we have, what do they do in terms of some of the training? We do, we give them training on introduction to counseling, the skills, so about listening, clarifying, reflecting, summarizing, the issues that abusive women bring into counseling, assessment, ethical principles of counseling, and all of that. Then we talk about the mediation, and mediation negotiation. So all of these are part of the training that we do for the combat.
Thanks, Dorcas. So we're going to the next question. We have a very interesting question from Hope Harriet. She says, thanks for the great presentation. Did you encounter incidences where you learned that some combats are the perpetrators of violence or survivors of violence? How do you deal with that and support them despite the criteria of nonviolence? Are there any lessons from this?
All right. I would not say from this particular intervention at this time, but we've had issues in previous interventions where after a combat, you know, that he was a combat member after he'd gone through all the training. And then once we went into the field for the monitoring, and the community raised this issue about the person, saying that, you know, he was abusive, because, you know, even though he was a member of they've since, you know, I think something has happened between them. So there was always a problem between the wife and the husband. There was beating. So they decided, the community said, we cannot have this man as a combat any longer. So they did, based on that, we talked to the person and said, this is what has happened. He tried to justify himself, but then in the end, what he said was that he would, you know, step down as a combat member. But then we had to work with him to try and, you know, negotiate what the issue was. They were in a farming community. They were farming palm oil. And I think the man, you know, they were selling to an oil company. And then when the money, when he goes, and it was in his name. So when he gets the money, then it becomes a problem sharing it with the wife, even though the wife, he worked with the wife. So in the end, they divorced, but, you know, but in this, as I said, in the particular context, we did not have that problem. Maybe it's because it was only a short period. We were there for only 18 months. In previous interventions, we were there for 4 or 5 years and so on. So that is why sometimes some of these things can come up.
Yeah, the next question is from Inma Otis. She says, thanks a lot for all the information, so relevant. I'd like to know if the combats express to you what are their great challenges.
Oh, yes, they do. Some of them, their challenges are that, like everything else, in a group, you know, we have the combat for every, like, community. There'll be about 6 of them. Sometimes you find that, you know, there are only about 3 or 4 who are very active doing all the work. The others, you know, when it comes to time for them to go out, they always have an excuse. So that's one of the challenges that they would usually talk about. Of course, the issues about wanting to be remunerated for their work. And that is something that we have always tried to, you know, make sure, let them know right from day one that this is not unemployment. You're doing this on a voluntary basis. What we'll do is to give you, refund your expenses related to the work. And so in one particular instance, not under this project, what we have done in a community was to link them to an organization that was providing microcredit for them to be able to get some, you know, but not under this particular project. We haven't done. That is something that probably an upscaling could also look at. I've already said so that, you know, when you work in a very, a community that is, you know, poverty endemic or cash trapped, maybe adding an economic intervention to this might help. I'm not sure, but, you know, it might help in some cases, but this is something.
Yeah. Thanks, Dorcas. Adolphina, the next few questions are for you. Selena Mazars has 2 questions. One is, did you measure if there was, did you measure access to formal services? And if yes, what were the results? And her next question is, how would you interpret that there is more reduction in victimization than in perpetration in your end line?
All right, thank you, Priya. The first one has to do with access to family services.
Yeah,
Correct.
family services. Yeah,
Okay.
maybe. Yeah.
So I'm not sure what the definition for family services would be, but if this has to do with what the social welfare does in Ghana, then I would say yes. Access to social welfare, if you've used any of such services before, yes, that was something that was done in the quantitative component. So only those that may have used such services will be the ones that we'll talk about where they've been. But then for in-depth interviews, we get a lot more details on for those that have experienced IPV, where they went for support or help, and how the processes went for them.
The next question from her was on how would you interpret that there is more reduction in victimization than in perpetration in your end line?
Okay. So I think that is similar to what I had tried to explain earlier about how we haven't fully assessed all aspects of the our findings yet. For example, we are beginning to understand that subgroup differences may account for why intervention works seems to be working for some groups as opposed to some other groups. So those are additional findings that will be coming out much later. But yes, generally, women would report lower victimization, and then the men might report higher perpetration. But keep in mind that we are not dealing with partners. We are looking at, as in people with their spouses. We are looking at couples, so any intimate partner. So not everybody was married. So we didn't have a husband and wife pair. Okay. So
Yeah.
that's one thing to keep in mind.
Adolphina, Celine has given us a clarification. She says she meant access to formal government services in general, like health, police, etc., and not family services. So
That's
she wanted,
yeah.
yeah. So she wanted
That's
to
what
know if you measured access to the formal those services.
Yes.
And what?
So I had talked about our key informant interviews, but with the heads of those all those institutions, so the police, Commission for Human Rights, Social Welfare, Ghana Health Service, we dealt with them all, and we took data from those institutions. So that is another aspect of the data that we would be putting out soon to talk about cases, how many cases seen, the different forms, what kinds of intervention all those got, what stages they were at by the time the study was wrapping up, and then what information we got from the key informants about their experiences of how people perceive the services and actually use it. So again, that is another thing that would come out later.
Yeah.
Thank you.
The next question is from Tavisha. She's asking a question regarding the quantitative data. She asks, were levels of violence between control group and the intervention group similar during the baseline? And what was the level of randomization?
All right. So qualitative data, we don't have numbers to say whether it was significantly more or less, but we are certain that from what we were finding from our focus group discussions and our in-depth interviews, it really supports what the quantitative was showing, that as at baseline, we had IPV in both control and intervention. Our focus was the intervention areas, but the IPV levels were much higher in the intervention than in the control at baseline.
Okay, thanks, Adolphina. There's much excitement about combats and volunteers, so there are more questions on that. This is for Dorcas. Inma asks, do the combats have a minimum activities that they need to carry out at a time, or do they organize themselves as they want and then report back to you? Do you have leaders among the combats? And last, have they felt danger anytime because someone is against their work? If yes, what did you do about it? She says sorry for all these questions and also says thank you for explaining. Dorcas, this is for you.
Yes. That's okay. Yes. Now where's the question?
I can repeat them.
Please repeat the question.
Her first, Yeah, the first question is, do combats have a minimum number of activities that they need to
Yes,
carry out
yes.
at a time?
Okay. Okay. No, they don't. But they have to cover all the topics that they have, gone through at it. So they decide, at any time when they go out that, when they go to this community, today we're going to talk about the different types of violence. Then, next time when we go there, we'll talk about the consequences. The next time we go, we'll talk about the laws and so on and so forth. So they are flexible. As I said, they are volunteers. So we cannot restrict them to what how much they should do. And especially if it comes to the time when, say in the farming season, you can't expect them to do much because during that time they'll be busy doing their, what brings them the economic resources. So you can't take. But if you look at the earliest one of the slides, within the 18 months, the combats had been able to reach over 24,000 individuals through their sensitization and awareness raising. So, it's really up to them. We give them the free hand to do whatever it is that they do. But they expected that, if you go here today and you're only able to talk about one, you have to go do the follow-up visit and talk to them about it. In terms of their, any dangers, we did not, under this, we did not hear anything about them suffering injury. But what we suspect is that sometimes some of the men, and this came from some of the focus groups, the qualitative information at base. Some men were, had complaints about the combat, that, they were not, they had all sorts of complaints, which if you analyze it well, it just sometimes is those men who have had, their wives complain about them and so on. So the men are not happy, and therefore they want to give a bad name to the combat member. But so far, we have not had any complaints from the combat that, somebody attacked them or so. And I guess that is because, as I said from the beginning, the community is intensely involved in the selection. They have accepted the project, and probably that's why they have not come across any such difficulties.
Thanks, Dorcas. Moving on, Adolphina, this is for you. Celine has a question on food insecurity. She asks, what is it prevalent in the community? Was it measured when you researched the drivers? If it was prevalent, how was this issue tackled during the intervention?
So
Please
yes,
go ahead,
food security is one thing that I have to say we are actually again currently working on. Yes, we report on food security in characteristics of the communities, and what we were saying was that it seems that there is some association between food insecurity and experience of IPV, but not necessarily with the perpetration. So that is also one aspect that we were thinking of for the subgroup analysis, to see which groups seem to be the ones that were more food insecure and had any form of IPV. So for our end line findings that are out there, there is a little bit of information on that, but there will be a lot more coming out in terms of a paper dedicated solely to understanding why we see shifting dynamics in terms of food insecurity and experience as well as perpetuation.
Okay. Mikaya has a question. She says, social welfare support in my area is zero. Where else will victims get help from in such a context?
So we have, in addition to social welfare, for us in Ghana, the Commission on Human Rights and Administrative Justice is available. The Ghana Health Services also has their own division that assists victims. Because generally the thought is that people would go to the Domestic Violence and Victim Support Unit, which is more or less a subdivision under the police. But when the word police is mentioned, of course, there are some partners where that even though they disagree about what happened and they know it constitutes violence, they don't necessarily want to involve formal authorities per se or make it look like they are reporting the partner. So they would prefer some mediation or the other. So all these other institutions exist in addition to the police and social welfare to support victims.
There's some program questions. Question is from Abigail Adumolga. She asks, I'd like to know if you could share your manual with us to use in our community engagement.
Yes, we can. We can share the manual. The only thing is that the completed manual is a hard copy, a printed one, because the soft copy does not have all the, the drawings and, some of the things. So you would need the hard copy.
Okay. So we have 5 more minutes, and it's a good question to wrap up with, unless we have more coming. It's from Patricia Essel. She asks, what has been your greatest challenges towards sustaining the efforts and successes stoked in the communities?
I think the challenge has been, how do we continuously continue our engagement with the combat even after we have left. In previous interventions, we have worked with community-based organizations as our partners. So because they're in the community, they're able to then continue to support the work of the combat. But under this interview, where we did that, we didn't do that. And so we're hoping that when we do the upscaling, we'll be able to go back there and then support, work with the other organizations within the, whether the district level or community that they can. But we are in contact. We are in contact with the combat members. They call us every now and then to ask some questions. We call them to find out what they're doing, if there's anything new that they would. And the other thing that we also do is sometimes we link them up with other organizations that are working in the community on different things. Sometimes you find that there's an NGO going to that community that wants to work with volunteers. And if we get to know, we'll tell them that, look, these are people that we train, they have skills in this and that area. If you want them, you can use them to improve so that they can, because they're already known in the community. So I think that this is something that, you can continue to do.
All right. We have to wrap up now. There were 41 of you today at the webinar, and you guys made it a great engagement forum and discussion. If you have any more questions or want to discuss further, feel free to send them out to our Twitter handle. It is @prevent_collab, @PREVENT_COLLAB. I'd like to thank Dorcas and Adolphina again, Rita for chairing the session, Sharon, whom you all cannot hear because she's behind the scenes managing the tech. She's our tech superhero. And I'm Priya. I'm a senior associate with the Prevention Collaborative. It was lovely to have you all. Do follow us on Twitter and visit our website. Thanks, everyone.